Hi, my name is Brandi. I'm a student at Maryville University, and this is my head-to-toe assessment video for the advanced assessment class. This is Kathleen. She's my volunteer today. Before we entered the room, I had Kathleen empty her bladder. I had her change into a gown. We took a full set of vitals with height and weight. We also tested her distant vision with the Snellen chart and the Rosenbaum with the near chart. We tested her near vision with the Rosenbaum chart. Both were 20/20, and we were testing cranial nerve 2. I'm going to go ahead and wash my hands, and we'll begin the general inspection. So looking at Kathleen, I can see that she has an appropriate manner. She has good hygiene. She's oriented, coming from back to the room. She had a stable gait. She has clear and articulate speech, and she is well nourished. So we'll go ahead and look at the head and face. So on inspection, I can see that her skin is uniform. There's it's unblemished, no signs of infection. I can see that her head is round. It is normal cephalic. It's upright and still. I can see that her hair has even distribution. There's no signs of alopecia. And I'm going to go ahead and palpate. I'm palpating for any depressions or any masses. I'm going to palpate her facial bones for any masses or lesions. And I'm going to palpate her frontal sinuses for tenderness. And we'll palpate the temporomandibular joint for any pops or clicks. So go ahead and open and close. Okay, and while we're here, we can test a couple of the cranial nerves. Cranial nerve 5, the trigeminal nerve, we'll test with the light sensation. So what I'm going to have you do is I want you to close your eyes. I'm going to touch you on places of your face. I want you to tell me if you can feel them and if it's symmetrical. Can you feel that? Mm-hmm. Is it symmetrical? Yes. And this? Yes. Okay, and that? Yes. Okay, good. And we can also test cranial nerve 7, the facial nerve, doing various facial movements. So I want you to wrinkle your forehead, squeeze your eyes tight shut, smile, clench your teeth, and puff out your cheeks. Okay, good. And those were all symmetrical and intact. Now I'm going to look at your eyes. I'm looking for any signs of edema or drainage. Any exudate. Her eyebrow hair is evenly distributed. Her eyebrows raised symmetrically. Her eyelashes curl slightly outward. The sclera is white. The conjunctiva is pink and moist, no signs of irritation. I'm going to palpate the lacrimal apparatus for any excess tearing. Now I'm going to test cranial nerves 3, 4, and 6. We're going to test for pupillary response first. So I'm going to use my pen light, and I'm going to have you follow. I want you to look at the back of the wall and fix on that, and I will go ahead and do direct and consensual, and the other side direct and consensual. Good. And then I'm going to do an uncover and cover test. So I want you to put your hand over one eye, focus on the back wall, and take it down. Good. And the other eye, and take it down. Good. We're looking for any lid drooping or any signs of nystagmus. So now we're going to do the 6 cardinal gaze, and this I want you to follow the tip of my pen without moving your head. And we'll do convergence. Good. And now we're going to test your peripheral vision. So I want you to cover one eye, and I want you to tell me when you can see my fingers. Okay. Okay. And the other. Okay. 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 Good. And now we're going to look at the red reflex of her eye. I'm going to get the ophthalmoscope. I'm going to look at the right eye with my right eye, and I'm going to start at 0. Okay, good. And I'm going to look at the left eye with my left eye. And good. Okay. Okay, so now we're going to look at her ears. Her ears are symmetrical. They're aligned with the outer canthus of her eye. There's no signs of inflammation or redness. I'm going to palpate the outer ear. It's mobile, firm, non-tender. I'm going to look in the ear. going to look at the inner ear canal. It's clean, it's clear, there's no signs of redness or irritation. The tympanic membrane is a pearly gray, there's no perforations, bulging retractions, or signs of infection. There's bony landmarks and there was a light reflex. I would also do the same thing on the other ear. Now I'm going to test cranial nerve 8, which is the vestibular cochlear nerve for your hearing. I'm going to do a whisper test. I want you to cover one ear. I'm going to go behind you and say a common word. I want you to repeat that word. Apple. Okay, and the other? Banana. Okay, and now we're going to do the Weber test. I'm going to strike this and put this on your head, and I want you to tell me if it's symmetric. Yes. Okay. And now we're going to do the Rene test. I'm going to strike it again. I'm going to place on your mastoid bone. Tell me when you can no longer hear it, and I'll move it to your ear, and tell me when you can no longer hear that. Okay. Okay. Okay, and that was testing bone versus air conduction. Air is usually 2 times greater than bone conduction. Okay, so now I'm going to look at your nose. Inspection of the nose, it is midline. There's no nasal flaring or discharge with palpated for tenderness. I'm going to go ahead and have you tilt your head up, and I'm going to look back into the nose. I can see that the septum is midline. There's no deviation. There's no drainage or blood. The turbinates are the same color as the surrounding skin tissue. There's no polyps or any signs of obstruction. I want you to go ahead, we'll test nasal patency. I want you to go ahead and plug one side of your nose and take a breath in. Great, and the other. Okay, good. So now we're going to look at the mouth and the pharynx. The lips are pink, moist, there's no cracking, lesions. I'm going to look in your mouth, so open your mouth for me. Okay, the mucosal mucosa is pink, it is moist, it's glistening, the gums have tight margins to the teeth. There's no signs of inflammation. There are 28 white teeth without discoloration. Go ahead and lift your tongue up. The floor of the mouth is without lesions, no signs of oral cancer. The uvula, go ahead, the uvula is midline. The tonsils are a grade 1. Anterior posterior pillars are intact without redness. The hard palate is intact. The soft palate is intact and aligned with the hard palate. And there's no odor. And the tongue is midline without tremors. It is a pinkish red, slightly rough. And we'll go ahead and test cranial nerves 9 and 10. We'll do an ah and a gag reflex, and then I'll have her swallow. So I want you to go ahead and stick your tongue out and say ah, and gag. Sorry. And then I want you to swallow. Okay, good. We can also test cranial nerve 12, the hypoglossal nerve with some tongue range of motion. So stick your tongue out, move side to side, up and down, and press against my fingers. Okay, good. Now we're going to look at the neck. Inspection of the neck, they're equal muscle mass. There's no obvious pulsations, no visible venous jugular distension. The thyroid is not visible. We're going to do some active and passive range of motion. So can you flex your neck and backwards and ear to shoulder on both sides and look backwards. Good. Okay, and then we'll do some with resistance. So forward, backwards, side, side. Good, and then we'll have you do a shoulder shrug. The shoulder shrug also tests cranial nerve 11, the accessory. So now I'm going to palpate the neck. I'm going to palpate the carotid pulses one at a time. Okay, and then I'm going to make sure the trachea is midline. And I'm going to palpate the thyroid. Can you swallow? And it moves smoothly up and down. Now I'm going to palpate the lymph nodes, the occipital, post-auricle, pre-auricle, tonsillar, submandibular, submental, the anterior cervical chain, the posterior cervical chain, and we'll do the deep cervical on both sides, the supraclavicular, infraclavicular, and lift your arms up, and the auxiliary. Now I'm going to auscultate the carotid arteries and the thyroid. So I'm going to have, I'm listening for any bruits, and I want you to take a deep breath in with the bell of my stethoscope. Take a deep breath in and hold. Okay, good. And when you're ready, do the other side. Okay, and breathe, and I will auscultate the thyroid. Also listening for any bruits. So now we're going to do the upper extremities. I can see that the upper arms have equal mass, length, size. The skin is warm, dry, and intact. There's no signs of cyanosis, no edema. The nail beds are pink. The nail plates are hard, smooth. Capillary refill is less than 3 seconds. There's no signs of clubbing or splitting. I will palpate the brachial pulses and the radial. Okay, so now I want you to go ahead and turn around. We're going to look at the posterior back and lungs. So inspection of the back, I can see that her skin is uniform. There's no signs of infections or lesions. The AP diameter is less than the lateral diameter. I'm going to palpate for any masses. Okay, and I'm going to percuss the costovertebral angle for tenderness. Okay, good. Now we're going to inspect the lungs posteriorly. The respirations are even and unlabored. I can see visible chest rise and fall with each respiration. They're unlabored at an appropriate rate. I'm going to palpate for thoracic expansion. So I'm going to put my hands here and have you take a deep breath. And I'm making sure that has symmetric rise and fall. I'm going to palpate for tactile firmness. When I place my hands on you, I want you to say 99. I'm looking for any increase or decrease firmness.
99, 99, 99.
Good, okay, and then I'm going to percuss the posterior chest, noting resonance. And the lateral, comparing side to side. Okay, and I'm also going to percuss for diaphragmatic excursion. So what I want you to do is hunch forward just a little bit, and I want you to take a deep breath in and hold. And I'm going to percuss for dullness. Okay, and I can breathe. And we'll go ahead and mark this. And when you're ready, I want you to take a deep breath in, exhale all the way, and hold that. And I'm going to percuss up. And I will mark it. Go ahead and breathe. And this should be 3 to 5 centimeters. I would do the same thing on the other side of the chest. So now we're going to, I'm going to auscultate the posterior chest and lung field. So if you can take some breath for me. And the lateral, again comparing side to side. Okay, good. So I'm going to have you turn around so we can do the interior heart and lungs. Inspection, the skin is uniform. There's no signs of inflammation. There's no visible pulsations or lifts. There's no, the chest rise and fall is even. I can see that with each respiration. There's no accessory muscle use. There is, they're unlabored respirations. Now I'm going to palpate the chest wall. And I'm going to palpate the pericardium and the apex. And now I'm going to do the tactile firmness palpation. So again, 99,
99, 99, 99.
Good. And then I'm also going to percuss the interior chest, lung field, noting resonance. Good. Now I'm going to auscultate the anterior lung field. Take a couple breaths. Okay, and while I'm here, I'm also going to auscultate the arteries. So the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Okay, so now we're going to go ahead and look at the abdomen. So go ahead and lay down for me. And we'll move over here so you can get a better view. So I'm going to look at the skin characteristics. I can see that she has a muscular contour. The abdomen is flat. There's no distension noted. I don't see any visible pulsations. There's no obvious peristalsis. I'm going to go ahead and auscultate in the vowel sounds in all 4 quadrants. Okay, and while I'm here, I'm going to auscultate the arteries, so the aorta, the renal, the iliac, and the femoral. Okay, and now I'm going to go ahead and percuss. I'm percussing tympani, and there's dullness over organs. I'm going to percuss the liver border, listening for dullness, and I'm going to mark it. And I'll mark that, and it's 6 to 12 centimeters. I'm going to do the splenic dullness, so if you can turn on your right side for me. Okay? And we're going to go ahead and do some light palpation. Light palpation just for any muscle tenderness. And we'll go ahead and do some deep palpation. I'm going to palpate the liver border, so take a breath in for me. Okay, and then I'm going to attempt to palpate the spleen, which isn't normally able to fill. We'll go ahead and do the left kidney, the right kidney, and we'll do midline for the aorta. And as you sit up, I'm going to go ahead and look at your muscle tone and your muscles. Good. Okay, so the next thing we'll do is the feet and legs, the lower extremities. I can see that the muscle mass is symmetric. The length and size are the same. Their skin is warm, dry, and intact. No signs of edema or cyanosis. I'm going to check the capillary refill is less than 3 seconds. The nail beds are pink, smooth. The nail plates are smooth and hard. And then I'll palpate the popliteal pulses, which are 1+. I'll palpate for the dorsalis pedis pulse and the posterior tibial, and I would do the same thing on the other side. So now we're going to do some musculoskeletal movements. I'm going to check the reflexes first. So we'll do your brachial reflexes, and I'm looking for twitching of the hands, and then we'll do your patellar, and we'll do the Achilles tendon. Okay, and I would do the same thing on the other foot. Now we're going to test the muscle strength. So I want you to hold your hands up, push against me, pull, with the legs, push out, pull against me, and the feet, push up, and pull against. Good. Okay, let's go ahead and have you stand up. Let's check the hip flexors and have you do a squat. Good. Okay, and then face that way, and I want you to touch the floor. I'm looking at her spine. I can see that it's midline. There's no signs of scoliosis or kyphosis. Her hips are aligned. You can come back up. Go ahead and bend back and slide the hand on your leg on each side and rotate. Good. Okay, you can have a seat. And we'll make sure that we go over the neurological breakdown in case we missed any. Cranial nerve 1 is the olfactory nerve. That's the taste and the smell, which we don't have the kit to do here. Cranial nerve 2 is the optic nerve. We tested that with the Snellen and the Rosenbaum. Cranial nerves 3 is the ocular motor, 4 is the trochlear, and 6 is the abducens. We tested that with the ocular motor nerves of the eye, which is the 6 cardinal gaze. We did cranial nerve 5, which is the trigeminal nerve. We tested that with light sensation on the forehead, cheeks, and chin. Cranial nerve 8, which is the vestibular cochlear nerve. We tested with the Weber and their Rennie test. Cranial nerve 9, it is the glossopharyngeal nerve, and 10 is the vagus nerve. We tested that with the awe and the gag reflex. Cranial nerve 11 is the accessory nerve. We tested that with the shoulder shrug. And cranial nerve 12 is the hypoglossal nerve. We tested that with the tongue range of motion. And that is the end of the video. Thank you.